Thank you for joining us. This is an event about arthrofibrosis, raising arthrofibrosis, spreading awareness, and answering your questions. And today with me, I have the person who started this all, Dr. Kayley Usher. And I will let her introduce herself, and then we will move on to a few questions. Hi, Kay.
Hi, Yorgos. Thank you for that. I'm Kayley Usher from the University of Western Australia, and I also founded the International Arthrofibrosis Association. Anyone watching this can look up www.arthrofibrosis.info for more information on what we're discussing. And there'll be other experts in these YouTube videos that will go into more detail about the specific areas.
Thank you for that. And just a quick introduction of myself. I am Georgios Mavropalias. I am an exercise scientist and a researcher. And I initially started working with Kay because of our mutual interest in the connective tissues and the collagen and how that affects every part of our body. And then she introduced me to arthrofibrosis, and as an exercise scientist, I was really interested in that because it seems that movement and exercise has a bit of a interesting scenario or interesting applications there, which we will explore later in the next talks. And hopefully we can continue doing some research in better diagnosing and assessing arthrofibrosis, because it's difficult to assess sometimes, I think, but also finding some ways through movement and potentially some exercise to help manage the symptoms. So, Kay, if you want to start, I would like to ask you a few questions so you can introduce the audience and the people watching to arthrofibrosis and help them understand what it is and how it might affect, how it affects people.
Thank you.
Yeah. All right, well, let's start with a very basic. What is arthrofibrosis?
So arthrofibrosis literally means fibrosis of a joint. So it can affect any joint. And it's essentially a wound healing response that doesn't stop when it should. So healing's finished, it should stop. But that wound healing response keeps going. It becomes pathological. It's actually created by a special type of cell called myofibroblasts. And these are normal cells that get transformed into this new kind of phenotype. And these create the internal scar tissue in the joint, and they create adhesions and contractions. So the myofibroblasts are responsible for arthrofibrosis and fibrosis of any kind. There's the same pathology. And chronic inflammation keeps myofibroblasts active and prolonged. Basically, chronic inflammation promotes fibrosis. And then once it's going for too long, there are all these feedback effects that kick in between the inflammation and the fibrosis, and they're self-perpetuating. So it becomes very, very difficult to resolve.
Sounds that feedback loop is really what keeps it going, and yeah.
That's right, and that's what we really need to target with our medications.
Mm-hmm. No, thank you for that. Thank you. Now, it sounds I think many people are not aware of it. And when I say many people, including physicians, clinicians, and that's why I think with this day that you started, you try to spread awareness first to clinicians. And some people think that this disease is very niche, it affects very few people. If you could give us a bit of an idea, how many people develop arthrofibrosis?
Unfortunately for knees, we don't have a really good figure, but the estimate is that after knee surgery or injury, between 5 and 15%. There have been higher estimates for ACL reconstructions around the 35% mark. but hospitals are not required to keep statistics. So we don't really know. And in knees, it's usually a result of a trauma, an injury or surgery. But in shoulders, the cause usually isn't known, it's idiopathic. And shoulder arthrofibrosis seems to be the most common form, and it affects around 8% of men and 10% of women over their lifetime. So it's pretty common.
Wow. So we're talking about potentially millions and millions of people throughout the world that have that. And I would say maybe this is, it could be conservative because I know, because we have been talking about this, that the ways to diagnose it and assess it are very poor right now. And because also not many clinicians are aware of this, it doesn't get picked up, it doesn't get diagnosed. So it potentially, these numbers underestimate the true numbers as well. Would you say that?
Yeah, absolutely. Yeah. And that's one of the first things we need is good statistics to be kept. That's the fundamental that we need. There's a lot more, of course.
Oh, thank you. So potentially millions of people have these conditions, both in the knee and the shoulder. How does it affect the people that that develop this?
It's often extremely painful, especially in the early phases where there's a lot of inflammation, and there's the lack of range of motion of that joint, which means the limb can't be used normally. So people may not be able to do normal daily activities like walking in the case of knees, socializing normally, driving a car, dressing, all of those sorts of things. And it can rob people of their identity because, yeah, it can have a huge impact. But it's very individual, depends on how active that fibrosis is, how much inflammation there is. In the case of residual arthrofibrosis, it might not be so painful, but you still have the restriction in range of motion. And it also depends on which tissues are affected in the joint. So normally the fat pad and the capsule's affected, but there are other tissues. Any of the tissues in the joint can be affected. So you can get fibrotic nerves, tendons, muscles, all of that. So there's a lot of individual variation. And there's also a lot of variation in the psychological impact, but that can be very severe. So when people go to their clinician, they may not be believed. The clinician might not have even heard about arthrofibrosis, as you mentioned. They can be just sent away and told there's nothing wrong, or they might even be blamed for it, for non-compliance in physiotherapy, which is a common one. And I get a lot of people saying I feel gaslighted and traumatized by those kind of responses from their clinicians. So psychological support is important. We need compassion and understanding. And we also need society to be aware so that family understand, because quite often family don't understand and there's no obvious outward signs of what's wrong. There's often not a lot of swelling or redness in the joint, so people look at you and they might think, well, that person's perfectly healthy, what's wrong with them? I don't believe them. So that can be a real problem as well.
Well, it sounds that it can really severely affect a person's life, and not only that, not only in a physical sense, but also in a mental sense, and also the social support might not be there because it's not very it's not manifesting as other diseases. So yeah.
Yeah, that's right. Yeah.
Would you say that there are many available treatments for arthrofibrosis out there?
There are treatments out there, but getting access to them can be difficult, particularly in the case of medications. A lot of rheumatologists aren't aware of arthrofibrosis, so that's something we're trying to change. There are quite a lot of medications that can be repurposed that help, and our rheumatologist will be talking about those. But there's also obviously physical therapy, and we need highly modified approaches for that. And it should always be a gentle approach, should never be pushing through the pain. And patients should never be treated the same as somebody who's healing in a normal, healthy manner. And anecdotally, we've found that gentle passive stretching, cyclic stretching with a short duration hold of lasting seconds is very helpful for preventing the adhesions, especially in the early stage post-op. And even later on, it can help prevent the daily contractions that occur overnight and help maintain range of motion.
Thank you for that. And yeah, it was something as an exercise scientist that I learned from reading about arthrofibrosis and talking with you, that many times exercise is not the panacea for everything, and sometimes lower intensity movement or just passive movement, cycling, stretching is enough. In some cases, an exercise can exacerbate problems, so we have to be aware of that as exercise scientists as well, not just doctors and orthopedics and other physicians. Thank you for that. Apart from medications and pharmacological treatments, are there maybe any dietary supplements or something about the diet that maybe hold promise to help people with arthrofibrosis?
There are a couple of promising things out there. I'd just like to preface this by saying that before starting a new supplement, people should always consult their doctor, particularly if they've got allergies or they're already on medications, because any supplement can interfere with medications. So the leading ones that are there that have been rigorously tested in scientific trials are quercetin and Avmacol. And these have both been used in treating solid tumours, cancers. And there are actually quite a lot of common pathways between fibrosis and cancer, which suggests that they might be helpful in treating arthrofibrosis as well. And we know that both of these reduce inflammation. So they're quite interesting possibilities. Omega-3 fatty acids and aspirin work together, and these have been studied for a long time. And we know that these increase the production of the body's natural pro-resolving compounds called resolvins, and that helps the body fight that inflammation and get control of it. And yeah, I'd just like to say that other NSAIDs apart from aspirin shouldn't be taken longer than a week, because they can actually have counterproductive effects and can actually increase inflammation by stopping the production of resolvins. That's something that isn't widely known.
Thank you for making us aware of that. And would you say that there may be any other things that the average person should know that could help them?
Yeah, for sure. We know that a diet that's high in fibre and low in sugar is very important for reducing inflammation, and probiotics and prebiotics, which is the fibre, is also important. So we need to look after our gut health. Gut health has a big influence on inflammation. People shouldn't underestimate that. Also, good quality sleep's very important, and melatonin can help in some cases, and is also an anti-inflammatory compound. And in addition, stress reduction is important, so people should try and minimise that as much as possible. And learning mindfulness skills can help in that regard. And it's a good life skill to master in any case for everybody.
Sounds like a common theme among all these interventions and supplements and maybe medications is managing inflammation, and that's the from what you said before, that's the key player that drives arthrofibrosis.
Yeah, that's correct. Yeah. Although, yeah, it is important.
Yeah. In the beginning, you mentioned that after surgery, there is a percentage of people that develop arthrofibrosis or after an injury. It came to my mind the question that I wanted to ask you: if you have done a surgery previously, does that by itself increase the risk of having arthrofibrosis later in life?
Yeah, it does seem to. And we think that that's because every time you have a wound like surgery, the myofibroblasts are formed. And if that wound heals in a healthy way, most of those will go away. But we think that there's always a certain percentage that don't go away, that remain there. And they can become immortal. And while their numbers are low, they're not doing a lot. But with each surgery, those numbers build up more and more. And you might get to a tipping point where the next surgery, you've got so many immortal myofibroblasts that you tip over into fibrosis, and suddenly you have arthrofibrosis.
I see. So there is evidence that there is an increasing risk for developing arthrofibrosis after a surgery. So yeah.
Yeah, that's one of the well-known risk factors.
Mm-hmm.
Mm.
Well, thank you, Kay, and we will hear a lot of other interesting stories and thoughts and what is happening with research from the rest of the speakers. But I wanted to ask you, what message would you like to pass to any clinicians that are watching this?
I'd really like clinicians to educate themselves about arthrofibrosis and the pathology of it, and to be aware of it and to be alert in their patients. So particularly if somebody's had an injury or surgery, keep an eye out for any of the signs of arthrofibrosis, that somebody's not healing in a normal way, and be prepared to adapt their protocols. And if a protocol is causing increased symptoms, listen to that person, respect what they're saying, and modify the approach. You can't just keep pushing through and hoping that that'll work. So highly modified approaches tailored to the individual. Medications should be introduced early on to reduce inflammation. There are some anti-fibrosis medications that are starting to be proving their worth in the research. And the other thing I would like to say is, if somebody has arthrofibrosis after they've had a total knee replacement and they go back to their surgeon, in my opinion, a revision total knee replacement should not be the first option that's considered, because this is a major surgery, it's a major wound, and this is normally would be very strongly stimulate fibrosis. So other options should be considered before that. And a revision, in my opinion, a revision TKR should only be done if there's a severe and obvious problem with the prosthesis. Shouldn't be the standard. And clean out surgery to cut those adhesions in there could be an option in that case. But in general, I'd say people should look at gentle approaches, use of medications, modified techniques, and psychological support people and listen to them.
Yeah, thank you. Wow, that was some very valuable information. I feel in a very concise way. So thank you for all that. And yeah, thank you for starting this day, the 20th of April, as the International Arthrofibrosis Awareness Day. And I think, yeah, I think more and more clinicians will start to become aware of it, and that will help people manage their symptoms and maybe reduce suffering, hopefully. So thank you for that. And I am excited for the rest of the talks on this day. And I think a lot of people will find them interesting.
Thank you very much, Jorgis. Appreciate it.
Thank you.
Bye.